This video is brought to you by the KZN an organization representing GPs in KZN.
It is my honor to introduce to you my colleague, Dr. Niven Govender, who practices out of Phoenix.
Thank you. And I would like to introduce my fellow colleague and good friend, Dr. Prithi Ramlakan, a general practitioner practicing from the Newcar Medical Center. We are in the middle of our second wave of coronavirus in South Africa, and as doctors at the coalface, we are watching patients confused and lost amongst all the advice from the media and social groups. We decided to create this little video clip to keep and share as a 4-point practical guide on what to do when you contract COVID. We are not presenting advice on what medicines or vitamins to take. This guide is how to prepare and watch out for warning signs of deterioration.
In our effort to look at what can be done in this COVID-19 pandemic to reduce the number of lives being lost and to reduce the number of hospitalizations, we have decided to come up with a process that will assist you out there in getting saved from what could be serious lung difficulty or serious complications of COVID. As we know, South Africa does not have a flu epidemic. South Africa has a COVID pandemic. So the first lesson for all of us is any symptom that sings of cold, cough, flu, body aches and pains, diarrhea, feeling tired, fatigue, etc., is COVID till proved otherwise and not influenza. This will help us to actually make sure we don't walk around transmitting COVID thinking that it's just a flu.
First and foremost, we need to keep a record of when your first symptoms started. These include fever, cough, sore throat, diarrhea, vomiting, loss of taste or smell. This is extremely important to us as doctors, and it helps us guide us through when the virus peaks in your system and when you are likely to get breathing or respiratory problems. Save the date in your calendar, write it on your fridge, on a notebook, wherever it is. You might forget, especially as you start to get ill, but this is critical to us.
We know that once you start to have the illness and you've done your swab test and have been diagnosed with COVID, you need to ensure that you monitor 4 main symptoms. And the symptoms are your pulse, your oxygen saturation, your respiratory rate, and your temperature. We call that the PORT, P-O-R-T. Why is this important? This tells us a lot about whether you have impending respiratory problems which can lead into great difficulties for patients. The pulse oximeter is a simple tool that we can use to monitor your oxygen saturation. It is easily used. Once it is switched on, you will be able to get the readings that are there on the machine. We want your oxygen saturation to be above 95.
95 becomes an important number. When we drop below 95, we're heading for trouble. But before you get too excited, first let's make sure the device is connected and working properly. Remember, nail polish and debris on your finger affects the reading. Try the device on different fingers. Use both hands. Take the highest reading. If your number is still below 95, do a few breathing exercises. With nobody else in the room, remove your mask, open the windows, and take deep breaths in and out. If your number is still below 95, you need to speak to your doctor urgently.